Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been having this persistent knee pain that really hurts a lot, especially when I walk. It feels like intense pressure, and it hurts like a son of a gun. I had an ultrasound done that showed there was a cyst at the back of my knee. It burst a while back, and it seemed to relieve some pressure, but the pain didn't go away. I had x-rays taken too, but nobody has told me the results yet, and it's been really frustrating not knowing.
I understand your concern. We will definitely follow up on those X-ray results today to see what might be causing this ongoing pain. Now, you mentioned that the cyst burst. Did you receive any treatment for it at the time?
No, I didn't get any specific treatment for the cyst when it burst. They just told me to keep an eye on it and let them know if it got worse. The fluid seemed to just go away on its own, but the pain remained pretty bad. I've been trying to manage it with Tylenol 3, but I'm running low and need a refill.
We'll sort out the refills for your medications as well. How about other symptoms? You mentioned feeling some tingling in your toes.
Yes, it's in the toes of my right foot. It's a constant tingling sensation. It's not painful, but it's always there, and it worries me a bit. It doesn't seem to go away no matter what I do.
Okay, we'll note that down and investigate further. Now moving to your general health, how have you been managing with your other medications? Finasteride, terazosin, and amlodipine.
I've been keeping up with those as prescribed. I'm also using an albuterol ipratropium inhaler for my breathing issues. Everything else seems stable, but it's tough without steady work. I've been unemployed, which makes it hard to afford my medications.
Understood. Let's make sure we address that today by exploring options to ensure you have access to your medications. You also mentioned occasional cocaine use. Can you tell me more about that?
It's not a regular thing, just sometimes at social events. I know it's not great for my health, especially with my history and current medications, but it's been infrequent.
It's important to be open about these things, so we appreciate your honesty. How about your exercise and diet?
I've been trying to keep active with some light treadmill and cycling, though I've been told to maybe tone it down with the knee issue. As for my diet, I try to eat well, though I had a bit of a scare with high potassium recently.
We'll revisit your diet, particularly your potassium intake, and see if adjustments are needed. Now let's talk about your family history of prostate cancer. How are you feeling about that?
It's always in the back of my mind since my dad passed away from it. I've had a biopsy before, which was negative, and my PSA levels have been monitored regularly.
That's good to hear that you're being proactive. Let's ensure we keep monitoring that closely. For now, let's check your vitals and then discuss our plan moving forward. Thank you for your patience. Based on today's examination and your recent labs, here are the findings. Your blood pressure is 128/78 mmHg, which is good, and your heart rate is regular at 72 BPM. Your weight is stable at 89 kilograms. Your CBC shows normal hemoglobin and white cells. However, your potassium is a bit high at 5.2 millikilo, which we need to manage with diet adjustments. Your kidney and liver functions are stable.
What about my knee?
The X-ray results show mild degenerative changes, but no significant joint effusion. This is likely contributing to your pain. Given this, I'm recommending a knee brace to help with mobility and pain. We'll also adjust your exercise regimen to include less impactful activities like swimming. I'll ensure you get the necessary refills today, and we'll arrange for a follow-up in 4 weeks to reassess everything. Does that sound all right?
Yes, that sounds good. I appreciate the thorough checkup.
Of course, it's important to stay on top of these things. I'll see you in 4 weeks, but if anything changes before then, please don't hesitate to contact us.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been feeling somewhat better since we stopped the lisinopril and that gout medicine, but there's still a lot on my mind. The muscle pain in my calves, it feels like I've been running marathons, which is funny because I can barely walk across the room without getting tired. It usually goes away after a few days, but it's uncomfortable. I also have this constant gas and diarrhea. I'm not sure if it's the new medications or what. My appetite isn't great either. I just don't feel like eating much these days.
I'm glad to hear there's some improvement, but we definitely need to address these symptoms you're still experiencing. It's important that we keep a close eye on how your body is reacting after stopping those medications. The muscle pain and digestive issues might be side effects, but they could also be related to other things. Can you tell me more about your diet and if you've made any recent changes to it?
Well, I've been trying to eat healthy, I have bananas pretty regularly since they're easy to handle and supposed to be good for you. Other than that, I haven't made any big changes. I've been a bit worried about my kidney function and what I should or shouldn't eat. Sometimes it feels like everything could be harmful in some way.
That makes sense, and it's good that you're mindful of your diet, especially with your kidney condition. We noted that your potassium levels are a bit high, which can be influenced by foods like bananas. We might need to tweak your diet a bit to manage that better. How about your daily activities and exercise? How are you managing with those?
It's tough, doctor. I used to be quite active, even with my jobs in construction and mold making, and I miss being on the move. Nowadays, I do some exercises at home when I feel up to it, but the leg pain and the tiredness make it hard. I feel like I'm gradually losing my strength, and it's frustrating.
It's certainly challenging, especially when your spirit is willing, but your body isn't cooperating. It's good to hear that you're still trying to stay active within your limits. Let's make sure we keep your physical capabilities in mind as we plan your care. Also, I'd like to touch on your experiences as a veteran. Do you feel that your time in the service affects your health now, or perhaps how you handle these health challenges?
Yes, I've seen a lot during the Korean War, and it does stay with you. I've had my share of tough times, and I guess it taught me to be strong. But as you get older, it feels like the body just doesn't keep up with the mind anymore. I try to keep a good attitude, take each day as it comes.
That's a very healthy approach, and your resilience is admirable. It's important to consider how these experiences shape your handling of pain and health issues. It could help us better tailor your treatment and support. Now let's go over the results from your recent tests and discuss the next steps.
Please go ahead. I want to understand everything that's going on.
Your recent lab results show some improvements, but also areas where we need to focus more. Your creatinine has dropped slightly to 2.5 milligrams Bel-Air, which is good, but your eGFR is still at 25 milliliter min with 1.73 μQ, indicating stage 4 chronic kidney disease. Your potassium is a bit high at 5.4 millimeters Corello, but it's lower than before, which is positive. We're also seeing a slight drop in your hemoglobin, suggesting mild anemia. No signs of protein in your urine, which is a good sign for kidney health. Your blood pressure and other vitals are fairly stable, which is good news. The chest X-ray and ECG don't show any major concerns right now.
Given all this, our plan will be to continue monitoring your kidney function closely with regular blood tests. I want to adjust your medications slightly to better manage your electrolytes and consider a dietitian's consultation to balance your diet, especially to manage potassium levels. It's also important that we address your muscle pain and fatigue. I think a physical therapy consultation could help with managing your symptoms and improving your mobility. We'll have you come back in a week to reassess after these adjustments. Does that sound okay to you?
Yes, doctor, that sounds like a plan. I appreciate your help in keeping track of all these things. It's a lot to manage, but knowing the details and having a clear plan helps a lot.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
I'm really worried about the hair loss. It's already starting to thin out.
I understand your concerns. Hair loss is a common side effect of chemotherapy, but remember, it's usually temporary. Once treatment ends, your hair will likely grow back.
But it's so hard to deal with. Every time I look in the mirror, I see a different person.
It's definitely challenging. Have you considered using wigs, hats, or scarves? Many patients find these options help them feel more comfortable and confident.
I haven't thought much about that. Are there specific places you recommend for wigs?
Yes, there are specialized stores and even nonprofit organizations that provide wigs for chemotherapy patients. I can give you a list of resources if you'd like.
That would be helpful. Thank you. I'm also worried about what my family and friends will think.
It's normal to feel that way. Communicating openly with them about your feelings and the changes you're experiencing can be beneficial. They care about you and will want to support you through this.
I guess I need to be more open about it. Thanks for the advice and support.
You're welcome. Remember, you're not alone in this. We're here to support you every step of the way.
Now look at question 26.
I've been hearing a lot about the difficulties pregnant women face when trying to access delivery services. What are the main issues?
One of the biggest challenges is the lack of facilities in some areas. Many women have to travel long distances to reach a hospital with adequate maternity care.
That sounds really tough, especially if labor starts unexpectedly. What about transportation?
Transportation is a significant issue. Not everyone has access to reliable transport, and public transportation options can be limited or non-existent in some areas.
I can see how that would add stress. Are there any initiatives to address these challenges?
There are some programs aimed at improving access, like mobile clinics and telemedicine services. However, these aren't always available everywhere and can be limited by funding and infrastructure.
What about financial barriers? Are they a concern as well?
Absolutely. The cost of prenatal care and delivery can be prohibitive for many women, especially those without insurance or with high deductible plans.
It sounds like a complex issue. What can be done to help improve the situation?
Increasing funding for healthcare facilities, expanding telemedicine services, and providing financial support to low-income families could make a big difference. Community education and support programs are also crucial.
Thank you for explaining these issues. It's clear that improving access to delivery services for pregnant women is a critical need.
Now look at question 27.
I can see you're feeling very upset right now. Can you tell me what's on your mind?
I just got some bad news about my test results, and I don't know how to handle it. It feels overwhelming.
It's completely understandable to feel this way. Getting difficult news can be very challenging. Let's take a few deep breaths together.
Okay, I just don't know what to do next. It feels like my whole world is crashing down.
It's important to give yourself time to process this information. You're not alone. We're here to support you through this. Have you had a chance to talk with your family about this?
Not yet. I'm afraid they'll be as upset as I am, and I don't want to burden them.
Your family cares about you and would likely want to support you. Sharing your feelings can help you all cope better. Would you like help figuring out how to approach this conversation with them?
I think that might help. I'm just so scared about what the future holds.
It's normal to feel scared. Let's focus on the immediate next steps and make a plan together. We can also connect you with a counselor who specializes in helping people navigate these emotions.
That sounds like a good idea. I think I need someone to talk to who understands what I'm going through.
Absolutely. I'll make sure to arrange that for you. Remember, we're here for you every step of the way.
Now look at question 28.
Thank you all for joining today. Our focus is on improving caregiver education. Let's start with an overview of current challenges.
One major issue is the lack of standardized training across different caregiving roles. This leads to inconsistency in care quality.
Agreed. We also see a lot of caregivers feeling overwhelmed and underprepared, especially family members who suddenly find themselves in caregiving roles.
We should consider developing comprehensive training programs that cover essential skills and knowledge. This could include basic medical care, emergency response, and emotional support.
Another point is the accessibility of these programs. Many caregivers have limited time and resources, so training needs to be flexible and affordable.
Online modules and local workshops could be a solution. They offer flexibility and can be more easily tailored to individual needs.
Good idea. We should also look at ongoing support, not just initial training. Regular check-ins and refresher courses can help caregivers stay updated and feel supported.
We might also partner with local healthcare providers to offer resources and support groups. This way, caregivers can share experiences and advice.
Let's not forget the emotional aspect. Caregiving can be very isolating. Providing access to mental health resources is crucial.
Absolutely. Incorporating mental health support into our training and offering regular counseling sessions could make a big difference.
These are all excellent points. Our next steps will be to develop a detailed plan and seek funding to implement these programs. Thank you all for your valuable input.
Now look at question 29.
What are the key benefits of delivering health services directly to seniors in their homes?
There are several. First, it increases access to care for those who have mobility issues or live in remote areas. They receive the necessary care without the difficulty of traveling.
That makes a lot of sense. How does it affect their overall health and well-being?
Home health services can significantly improve seniors' quality of life. It allows for more personalized care, which can lead to better health outcomes and greater patient satisfaction.
Are there financial benefits to this approach as well?
Yes, it can be cost-effective by reducing the need for hospital visits and long-term care facility admissions. Home care can manage chronic conditions more effectively and prevent complications.
What about the emotional and psychological impact on seniors?
Being in a familiar environment can reduce stress and anxiety, which is particularly beneficial for seniors with cognitive impairments like dementia. It also allows them to maintain their independence longer.
How do we ensure the quality and consistency of care in a home setting?
Training and supporting home health aides are crucial. Regular assessments and using technology for monitoring can help maintain high standards of care.
It sounds like home health services for seniors offer numerous advantages. What are the main challenges in implementing these services?
Funding and resource allocation are significant challenges, as well as ensuring that there are enough trained professionals to meet the demand. But with proper planning and support, these obstacles can be overcome.
Now look at question 30.
I understand managing multiple medications for your conditions can be challenging. Let's go over your current medications and how they work together.
I'm taking medications for asthma, chronic kidney disease, and osteoarthritis. Sometimes it's hard to keep track of everything.
You're on fluticasone salmeterol for asthma, ramipril for your kidney disease, and NSAIDs for osteoarthritis pain. It's crucial to follow the prescribed dosages and timings for each.
I try to, but sometimes I forget or get confused.
Using a pill organizer or setting alarms on your phone can help you remember. It's also important to understand how these medications interact with each other and with any new prescriptions.
Are there specific interactions I should be aware of?
Yes. For example, NSAIDs can affect your kidney function, especially since you're taking ramipril. It's essential to use the lowest effective dose and not to exceed it.
That makes sense. What should I do if I miss a dose?
If you miss a dose, take it as soon as you remember, unless it's almost time for your next dose. In that case, skip the missed dose and continue with your regular schedule. Never double up.
Got it. Is there anything else I should be aware of?
Make sure to regularly monitor your symptoms and report any changes to your doctor. Also, keep all your healthcare providers informed about your medications to avoid any potential conflicts.
Thank you for the advice. I'll make sure to follow it carefully.
You're welcome. Managing multiple conditions can be tough, but with the right strategies, you can stay on top of your health.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Good morning, everyone. Today, we will embark on a detailed exploration of how diet and lifestyle play pivotal roles in cancer prevention. This discussion is grounded in recent cancer statistics and evidence-based guidelines, highlighting the potential for diet and lifestyle interventions to significantly reduce cancer risk. Let's begin by understanding the context of cancer within our society. Recent data suggests that in the year 2022, approximately 85,000 cancer cases could potentially be prevented. Specifically, colon cancer in men and breast cancer in women represent a significant portion of these preventable cases. These numbers not only underscore the urgency of adopting preventative strategies, but also frame our discussion today. The foundational principles of cancer prevention involve a holistic approach to diet and lifestyle. The guidelines provided by leading health organizations stress the importance of maintaining a healthy weight. This involves focusing on healthy eating habits that extend beyond mere weight loss, emphasizing nutritional quality and balance. Additionally, the guidelines recommend limiting the intake of sugary drinks and energy-dense foods, which are often low in nutritional value but high in calories. Transitioning to a plant-based diet is strongly advocated. This diet emphasizes fruits, vegetables, whole grains, and legumes, all of which contribute to a lower risk of cancer. These foods are not only rich in essential nutrients, but are also excellent sources of phytochemicals. Phytochemicals, such as antioxidants and carotenoids, play a crucial role in preventing the formation of potentially cancerous cells by protecting DNA from damage and inhibiting tumor growth. Consider the impact of such dietary choices through the case study of John, a 58-year-old diagnosed with early-stage colorectal cancer. Initially, John's diet was heavily skewed towards processed and red meats, with minimal intake of fruits and vegetables. Following his diagnosis, John was advised to modify his diet significantly. He incorporated more whole grains, doubled his intake of fruits and vegetables, and limited his red meat consumption to less than 18 ounces per week. These changes not only helped in managing his condition, but also improved his overall health markers such as weight, energy levels, and metabolic health. Physical activity is another critical component of cancer prevention. The general recommendation for adults is to engage in at least 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous intensity physical activity per week. This level of physical activity helps in maintaining a healthy weight, enhancing insulin sensitivity, and improving hormonal regulation, all of which are important in reducing cancer risk. For John, incorporating regular physical activities like walking and swimming significantly contributed to his post-diagnosis recovery and well-being. Moreover, dietary recommendations specifically aimed at cancer prevention emphasize variety and balance. A daily intake of 1.5 to 2 cups of fruits and 2.5 to 4 cups of vegetables is advised, ensuring a range of phytochemicals and nutrients. Whole grains and legumes are also highlighted for their fiber content, which supports digestive health and reduces the risk of colorectal cancer. Proteins should be sourced primarily from plants or lean, non-processed meats. Healthy fats, particularly those from plant sources such as avocados and nuts, are encouraged in moderate amounts to support overall cellular health. In the context of John's dietary overhaul, the focus was on introducing a diverse range of plant-based foods while reducing his intake of processed and red meats. Cooking methods were also adjusted to avoid high-temperature cooking like charring, which can produce carcinogenic compounds. Instead, John adopted cooking techniques that preserve the nutritional content and are lower in harmful byproducts, such as steaming, boiling, and baking. Adopting a comprehensive approach to diet and lifestyle can substantially reduce the risk of cancer. This involves not only making informed choices about what we eat, prioritizing plant-based foods, reducing processed and red meat intake, and choosing cooking methods wisely, but also incorporating regular physical activity into our daily routine. For those seeking more information and practical tips on implementing these guidelines, numerous resources are available, including websites dedicated to cancer prevention through diet, cost-saving tips, and recommended cookbooks and meal services focusing on plant-based diets. Thank you for your attention today. Remember, the choices we make daily profoundly influence our health outcomes, and by choosing wisely, we can significantly reduce our cancer risk and enhance our overall well-being.
Now look at Extract 2. Extract 2, Questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good afternoon, everyone. Today, I will present a case involving a 36-year-old female patient with a complex neurological presentation. Our discussion will delve into the intricacies of her diagnosis, the investigative process, and the multidisciplinary approach taken to manage her condition. The patient first presented with jerking movements on the right side of her face. These symptoms led to an initial diagnosis of focal seizures, and she was started on MPA 100 milligrams BID. Her medical history revealed no prior relevant neurological issues, which made this case particularly intriguing from a diagnostic standpoint. Upon initial examination and imaging, we found multiple T2 hyperintensity lesions on MRI. These lesions, some of which showed restricted diffusion, were located in critical areas including the cerebral peduncle, brainstem, and corpus callosum. Given these findings, our differential diagnosis primarily included demyelinating diseases versus neoplastic processes. To further investigate, a CSF analysis was performed. The results were negative for oligoclonal bands but showed mildly elevated light chains. This finding did not conclusively point towards multiple sclerosis MS, though it did not entirely rule it out either. In response to her ongoing symptoms, we increased her steroid dosage to 4 milligrams BID. Given the critical locations of the lesions and the potential diagnoses, a decision was made to proceed with an awake craniotomy for excisional biopsy and potential resection. This surgical approach was chosen to allow for maximal safe resection while continuously monitoring the patient's neurological function. During the surgery, a large exposure was prepared to accommodate potential future surgeries if needed. Despite the presence of large lesions underneath, the brain surface appeared normal initially. Interestingly, the patient showed clinical improvement during the procedure, suggesting that some epileptogenic foci may have been resected. Histopathology results provided critical insights. The biopsy revealed a high-grade glioma characterized by microvascular proliferation, mitotic activity, and hypercellularity. Immunohistochemistry results showed IDH negativity, ATRX retention, and p53 positivity. These findings are consistent with a more aggressive glioma phenotype. However, final molecular testing for IDH status is still pending, which will further inform prognosis and treatment planning. This case exemplifies the complexity of managing neurological disorders where multiple pathologies may coexist. The involvement of critical brain regions such as the inferior frontal gyrus and the motor cortex posed additional challenges. These areas are crucial for functions like speech and motor control, and their involvement necessitated a highly nuanced approach to both surgical and post-surgical management. Our multidisciplinary team, including radiology, neuropsychology, and neurosurgery, provided comprehensive care. Radiology emphasized the infiltrative nature of the glioma, noting features like hypercellularity and hypervascularity that are typical of high-grade tumors. Neuropsychology addressed the significant expressive aphasia and weakness that the patient experienced, which required targeted rehabilitation strategies. An intriguing aspect of this case is the potential dual diagnosis of glioma and a demyelinating disease such as MS. While the primary pathology appears to be a high-grade glioma, the presence of demyelinating lesions raised the possibility of concurrent MS. This dual pathology could have significant implications for the patient's treatment and prognosis. From a treatment perspective, we plan to proceed with standard glioma therapy, which typically includes surgical resection followed by radiation and chemotherapy. However, we will also closely monitor for any signs of MS, as this could necessitate additional therapeutic interventions. Managing such a patient requires a delicate balance between treating the aggressive glioma and addressing any potential demyelinating disease to optimize neurological outcomes. In a similar case reported in the Harvard Medical School archives, a 40-year-old male presented with neurological symptoms and was found to have both high-grade glioma and MS. His treatment involved a combination of surgical resection, radiotherapy, and disease-modifying therapies for MS. This case also underscores the importance of a comprehensive diagnostic workup and a tailored, multidisciplinary approach to treatment. The case of a 36-year-old female with high-grade glioma and potential concurrent demyelinating disease illustrates the critical role of a multidisciplinary team in managing complex neurological conditions. Our approach must be dynamic and responsive to evolving diagnostic information, ensuring that we provide the best possible care for our patients. Thank you.